Early signs and symptoms of brain hemorrhage. Sudden severe headache. One of the earliest signs of a brain hemorrhage is an abrupt, severe headache. The pain is often described as the worst headache of your life and can come on suddenly, without any prior warning. This intense headache is typically localized but can affect the entire head. It can be accompanied by nausea and vomiting. The headache usually worsens over time and may not subside with usual pain relievers. Nausea and vomiting. Nausea and vomiting frequently occur with a brain hemorrhage, especially when the bleeding increases pressure on the brain. The pressure interferes with normal brain function, including the centers that control nausea and vomiting. This symptom can appear alongside a severe headache. In some cases, vomiting may worsen the headache, creating a vicious cycle. Immediate medical care is required to address the cause of these symptoms. Weakness or numbness in limbs. Another common symptom of brain hemorrhage is weakness or numbness, often on one side of the body. This happens when the bleeding affects the motor control areas in the brain. The affected side may become weak or partially paralyzed, making it difficult to move a limb or walk properly. If the bleeding is significant, it can lead to total paralysis. Prompt treatment is essential to prevent long-term disability. Vision problems. A brain hemorrhage can also affect vision, causing blurry or double vision. These vision problems occur when the bleeding impacts the areas of the brain responsible for processing visual signals. In some cases, partial or complete loss of vision can occur. Vision disturbances are often accompanied by other symptoms, like headache or dizziness. This requires urgent medical evaluation to prevent further complications. Difficulty speaking or understanding speech. Difficulty speaking or understanding speech is another serious early sign of a brain hemorrhage. The blood may press on areas of the brain responsible for speech production and comprehension. The person might slur their words, have trouble finding the right words, or be unable to form coherent sentences. Speech and language difficulties can escalate quickly, so immediate medical intervention is critical.